My name is Carrie Sealy from Harlem Health Advocacy Partners. I'm the program manager at HHAP. We're located right there in the Action Center on 115th Street and Lexington Avenue. And we provide health coaching and group wellnesses and workshops such as this, as well as insurance navigation if you need help with your insurance, or if you need resources and referrals to other social service agencies. We have walking groups, virtual walking groups, and virtual peer support groups like this, where we meet on Zoom. We also are doing, getting ready to start our in-person walking group in some of the senior centers, and more information is going to come on that. All of our services are free, and we work with NYCHA residents as well as people in the community in zip codes 127, 129, and 135.
Loneliness and social isolation during the pandemic. What is social isolation? Social isolation is a lack of social contacts and having few people to interact with regularly. You can live alone and not feel lonely or socially isolated, and you can feel lonely while being with other people. So I'm going to talk a little bit about each. Causes of social isolation. We have all been living through a pandemic for about 3 years now. And in the beginning, people were losing their lives and contracting this virus and really getting ill. And so the government decided that we needed to shut down, right? Everyone needed to be at home in order to protect themselves and to protect other people. And while that did assist us with staying safe, it also caused us to be isolated because we were unable to continue to do the things that we enjoy doing, whether it was going out to a social day center, going to visit family and friends, taking trips, whatever it was that we enjoyed doing and had been participating in, we had to scale that back to the point where we were unable to do it at all. We really had to remain at home, and that causes social isolation. Mental health issues. When we're feeling depressed, when we're feeling anxious, that can impede our desire and our ability to want to socialize, right? When we're feeling um, down, when we're feeling sad about something, we're really not in the mood to interact with other people. Very often we are isolating and we're not taking calls and we're just not motivated to do the things that we ordinarily like to do. And that also causes isolation. Physical impairments. So you get into an accident and you have, you know, a broken femur, that is a broken bone in your leg that causes pain when you need to walk around. How excited are you, and how much do you want to go outside and walk around if this is causing pain? And I included social media as well because while social media keeps us entertained, it also can keep us isolated. If we are on our phones or we are on our computers all day long, we think that we're doing something really exciting and enjoyable, and to an extent it is, but it's keeping us at home doing this by ourselves. Unemployment and lack of income. So when we're unemployed or where we don't have enough income to do what the things that we need to do, we may not be able to pay for housing, have difficulty with obtaining food. We are really not in the position to, spend money to take the train or to spend any money for lunch or to do anything outside of our homes, right? Because our concern is having enough money to do what we really need. So that keeps us isolated. Intimate partner violence keeps us isolated as well. If you are in a relationship with someone, whether you live with them or not, and they are controlling and you are afraid, and they tell you that you cannot go out or they keep you from your family, you become socially isolated. And also the loss of a loved one. If you lose a partner or a friend, you can feel really sad and really depressed. And some people grieve for a really long time. And as a result, they do not want to socialize with people. They're sad, they want to stay home and not interact with other people. So these are all causes of social isolation. Texting. Texting may not be seen as something that can cause social isolation, but it does. And the reason that I say that it does is because when we're on our phones and we're texting back and forth to people, we think that we're having these big conversations. We run into people on the street, and the person may say, "Oh, have you seen Mary?" And you say, "Oh, yes, I've spoken with Mary." But really, what you've done is text, and you really don't know what's going on with Mary. You may not know that Mary lost her job. You may not know that Mary moved because Mary is not going to put all of that information into a phone. She's going to text, "I'm doing well. I'm hanging in there. I'm okay." And so there is really not any level of intimacy that's going on when you text someone. And that also keeps you socially isolated. So we're going to learn about 3 causes of loneliness during this training and this webinar. What is social loneliness, which is the first one that we're going to learn about? Social loneliness is when you haven't been able to build up a social network or when your circumstances have caused you to lose your social network. You may not have friends to reach out to when you want to connect. So social loneliness really speaks to not having a group of people, whether it's family or friends, that you can reach out to, that you can connect to when you want to not be alone. All right. So that is the definition to social loneliness. Emotional loneliness. Emotional loneliness arises when you have a healthy social network but lack connection on an emotional level. So you have nobody to share your intimate thoughts and ideas with, right? So let's say you join a new socialization program. You move and you attend the socialization program in Queens because that's where you're living with. That's where you're living now. You still may have those connections back in East Harlem, where you had been living before. But where you are now in Queens, you're meeting people that are new to you. And so you're not sharing as much about who you are and what you're thinking and what you're feeling because these people are are strangers still, right? You haven't gotten a chance to really get to know them. And you miss the people over at the social day because these are the people who knew that you just, lost a son, who knew that you were just diagnosed with diabetes and you're having a hard time with it, who knew that you had some issues in your apartment that were really stressing you out. So now we're going to move on to physical loneliness. Physical loneliness strikes when you lack the physical connection that's meant to complement close relationships. So what do people do when they haven't seen a loved one in a long time and they see them? What do we do when we walk into our family or friend's home on Thanksgiving or Christmas? You hug and you kiss, right? And why do we do that? We do that because we're human beings and human beings need tactile stimulation, right? What does that mean? We need to be able to touch one another. We need to be able to embrace one another. We need to be able to kiss one another, right? It's important to have that physical closeness with people that you love. And so, very often, if people live alone and they hardly see anyone, they are going to experience physical loneliness because they're going to go months and months and months without being able to give someone a hug or receive a hug from someone. They may go months and months and months. Let's say their grandkids live in another state. They go for a long time without being able to pick up their grandkids and kiss their grandkids and feel the warmth of their grandchildren's bodies against theirs. So, very often people are experiencing physical loneliness. So now I'm going to talk about New Yorkers specifically and what increases New Yorkers' risks for loneliness. And you'll see that some of the risks for loneliness for New Yorkers are they overlap with the risks for social isolation. So chronic disease or advanced stage, right? So again, if you have a chronic disease that makes you feel really, really ill, let's say you have asthma, and a lot of things irritate your asthma. The heat can irritate it, the cold can irritate it. That may keep you at home when it's really, really cold. There may be an event that's going on in your community that you can't attend because it's very cold and you don't want your asthma to get aggravated. Again, intimate partner violence. If you're living with someone or in a relationship with someone who's telling you that you cannot go out, who is isolating you from your family and friends, who monitors your phone calls, you may decide that it's safer to do what this person is asking you to do. And as a result, you remain lonely, you remain isolated. Communication barriers, right? New York especially is a city, it's a melting pot of people from all over the world. And we have immigrants coming into New York all of the time. So when people come into New York who don't speak English, they may feel lonely because they're unable to communicate with people. They may attend a social day program. Someone from, I don't know, Mexico may arrive to the States, and the daughter may say, "Mom, I'm going to take you to this social day program because I work until, 5 o'clock, and I don't want you to be here home alone and lonely." But if Maria doesn't speak English and she arrives to a social day program where most people don't speak Spanish, she may be physically around people but still feel lonely because she's unable to communicate with them. Limited mobility, right? So a person who is in a wheelchair, or as I stated earlier, has something going on physically with them that hinders their ability to move around easily. Let's say even something like dizziness. I know of people who wake up in the morning and their whole world is spinning, and they have good days and they have bad days. But on the days where they wake up and they're feeling really dizzy, they don't want to go outside, right? Because they're afraid that they're going to fall. It's hard to just even get out of bed. Or you may have, arthritis in your feet, or all sorts of things that make you say, yeah, nah, I don't want to go outside today. That keeps you isolated, that keeps you lonely. Recent crises, including the death of a loved one, hospitalization, eviction, family separation, and incarceration. All of these things are things that cause crisis in our lives, that cause us to feel sad, that cause us to feel depressed, that cause us to have anxiety. And when we're anxious, if we're afraid that we're about to be evicted, how how much do we want to, go to the museum, or go have tea or coffee with our friend in the next building? We don't, because we're worried about our possible eviction. If our child is incarcerated, and you were hoping for a shorter sentence, but then they get a really long sentence, you're sad about that, and you're really not in the mood to communicate. You're not in the mood to socially uh, participate in activities. And so that can keep you lonely. Caregiver responsibilities. How many of us have, sick parents, aging parents, children who may be sick, who we really have to physically be near them in order to care for them. And so this may also keep us isolated and lonely, because while we may want to accept an invitation somewhere, while we may want to go to a social day program, while we may want to take a little vacation, or just go for a ride with someone, or just go sit in the park bench, you can't if you are taking care of someone who absolutely needs you there all of the time, because they can't get up on their own, they can't, make something to eat on their own, they can't get to the bathroom on their own. You have to be there. And so you're assisting them, but you're unable to do what you need to do for yourself. You're unable to socialize, and you feel lonely. And economic insecurity, that goes back to what we talked about with, for example, the eviction. If you don't have enough money and you're stressed and you're worried about that, you really are not in the mood to socialize with anyone. And, with the high rents that we see here in New York, and with all of the other things that we talked about that can happen, this is one of the things, these are some of the things that keep New Yorkers feeling lonely and isolated. So, how has COVID increased social loneliness and isolation, social isolation and loneliness? How has COVID had an impact? Number one, social distancing and quarantine. It limited the spread of the virus, but it also kept people further apart, right? Which is something that I mentioned in the beginning. It was helpful to really contain this virus because it was bananas. So many people were getting the virus, so many people were getting sick, so many people had to be hospitalized. So the CDC, the government felt that it was best for us to remain at home as much as possible to minimize the risk of contracting this virus. But at the same time, what happened is that we were left home alone without our activities. I think the only things that were open were the pharmacy, maybe the bank, the hospitals. There wasn't much open at that time. So people had no choice but to remain at home. And for people that live alone or for people that live with other people but still feel lonely, this was difficult. And so another thing that happened was that senior centers were closed, right? So for all of us that relied on senior centers for our socialization, for social activities, to be able to sit down and have lunch with someone, those people found themselves without somewhere to go every single day. You know, there's some people that attend social centers 4 to 5 days a week, and it's how you knew that Miss Mary was okay, and how you knew that Miss Johnson's son was in the hospital, because you met up at the social day centers. But the social day centers closed, and people were left lonely and by themselves and without something to do during those hours of the day. Um, and again, activities began being held virtually, eliminating and reducing in person interactions, right? So you were able to go maybe to the pharmacy and maybe meet up with someone, but you know, how significant of an interaction is it meeting up with someone on the line waiting for their medication? I mean, you talk a little bit, you do speak, you know, you do talk about what's going on, but it might not be as meaningful as if you were able to go and sit down and have something to eat with someone. But our restaurants were closed and we were unable to do that. This was really a lifesaver in many respects, right? Because we were physically isolated as a result, but it meant that we didn't have to be completely socially isolated. You may have not had a friend visit you at home, but you could put them on Zoom and talk to them that way, right? So that really, um, it really helped a lot. So now I want to talk about something that we don't talk about as much when we talk about loneliness, but I thought it was important to discuss here, and that is the stigma of loneliness. Society has stigmatized loneliness to basically imply that there is something wrong with you if you feel lonely. So people have a difficult time admitting to themselves and to others that they feel lonely. But more than half of New Yorkers report feeling lonely at least some of the time, and everyone experiences loneliness at different times in their lives. So there's nothing to be shameful about because the feeling of loneliness is a universal experience, and that means that everybody has felt lonely at some point or another. But again, we have internalized, we've heard people say, people have implied, which means they've said it without saying it directly, that if you're lonely, then maybe there's something wrong with you, right? Why can't you make friends? Why don't you go out? Why don't you do this? Why don't you do that? And so people will report that they're feeling depressed. They'll report that they're feeling anxious. They'll report that they're feeling sad, but they won't as easily report and admit to the fact that they're feeling lonely. And it's important to do that because loneliness has a significant impact on our mental and our physical health. All right, so let's talk about the impact of social isolation and loneliness. Social isolation and loneliness negatively affects our mental and physical health in various ways, causing insomnia. That means we have a hard time sleeping. Digestive problems. Have you ever heard of someone say, I'm sick to my stomach? Lowered immune function, so we get more colds, right? Increased risk for heart disease and stroke. That may be a surprise to some. Depression, anxiety, and suicidal thoughts and ideations. This list is just a small list of ways in which we can be impacted. So it's not all inclusive. It doesn't include everything, but as we see, it includes some really serious things. Difficulty with sleeping. After a while, that causes other issues. Digestive problems are difficult as well if our tummies are always unsettled, right? Increased risk for heart disease and stroke. That's pretty serious. Depression, anxiety, and suicide. That is also pretty serious when we can be so lonely and so socially isolated that we become depressed and anxious and have suicidal thoughts, or actually complete a suicide. So it's serious, right? This is really serious stuff. All right, how to cope with feeling lonely during the pandemic. Now we're going to talk about how do we cope with this? What are some of the things that we can do to help us through this time because we remain in a pandemic. Some of us may remain lonely or not be getting as much socialization as we'd like to. So this is a list of just some of the things that we can do. Join a virtual group and activities, right? Zoom in many ways has been a lifesaver, right? Because we're able to see each other, we're able to hear each other, we're able to see the reactions on each other's faces, which is different from when you're texting on the phone. And that's why I put texting as something that can help to keep us apart more than it keeps us together. And also, we get more out of it than we do with just having a regular telephone conversation, right? So, again, I'm the first to admit that I had not heard of Zoom prior to this pandemic, and maybe some of you had not either. But here we are sitting on Zoom, looking at each other and looking at my slides and connecting with one another, right? So, the other thing that you can do is connect in real life if you feel that it's safe to do so, because there are a lot of people that are still really anxious about going out, and they have levels. Some people are comfortable now with being out in big groups, and some people not so much, right? Some people feel comfortable going out to their friend's home or to their family's home, but they're not ready for a concert or they're not ready to be, in a big auditorium or whatever. So it's whatever you're comfortable with. But if you are comfortable going out to a friend's home or going out to a family's member's home, um, then definitely do that. Begin to reconnect in person with people so that way you can get that physical contact that we talked about earlier and actually see people face to face. The other thing you can do is reach out to your family and friends via a phone call. And I put that on the list, even though we just talked about how great Zoom is and how nice it is to connect in person. But for some people, especially if you have a hard time walking, if you have an impairment that keeps you from being able to go out, or maybe you're a caregiver or have some other situation going on that really makes it difficult for you to get out as often as you'd like or even connect in this manner, a phone call can do, right? Actually picking up the phone and calling someone and saying, hey, how are you doing? How have you been feeling? How have you been getting through this pandemic? It's been hard for me. Has it been hard for you? Because we're often surprised. Sometimes we think when we're going through something that we're the only ones going through it, that we're the only ones that are lonely, that we're the only ones that feel like we don't have enough friends, that we feel like we're not getting out as much as we'd like to. And then you call somebody and you realize they're feeling that same way too, and that they're glad that you called and that they feel a little less lonely because they're talking to you. Another thing that I suggest is volunteering, either remotely or in real life. Um, I remember a Christmas, this was years ago, that I was feeling especially lonely and especially sad personally. I lost my mom around the Christmas holiday. And so Christmases can be tricky for me. And I remember that I had volunteered to give out food at the church that I was attending at the time. And on the day of, I think it was the 23rd or the 24th, or it might have been Christmas Day that we were giving out food. I wasn't in the mood to volunteer and to fulfill my commitment. Um, and then I felt bad and I said, you know what, Teresa, you signed up for this. Go ahead and do it. And I tell you, when I got there and I jumped on that line and I put on that apron and I got behind that food and I saw all of those people come in and how beautiful the place was decorated. And I thought about how we were giving people who may not have had any other place to eat and giving them food and community and fellowship time. I felt so much better. I really did. I was no longer thinking about how lonely I was feeling that day. I was no longer thinking about how sad I was because my mom wasn't around. I was no longer feeling all of the feelings that I was feeling earlier in the day. So sometimes volunteering, helping others helps us to help ourselves. Attend a social day program, right? Social day programs are one of the best ways that we can spend a day. We get to see other people, we get to see our neighbors, we have opportunity to get to know them better. Sometimes there are other activities that are brought in that are really interesting, and that we really enjoy and that maybe we might not have access to. Maybe they're free or low cost to us at the social day center. So socialization programs like the ones that we have here, with Smart University and everything that they have to offer are really, really, really important. So it's important to continue to stay connected to programs like these, because it gives us so much, but it also gives us an opportunity to connect with other people, which is so important and so needed to get through these crazy pandemic times. All right. You can also attend a class or a group, right? Maybe you've always wanted to learn to meditate. And so you join a meditation group online, or maybe you've always wanted to learn to make candles, or you've always wanted to learn to knit, or you've always wanted to learn to, I don't know, bake a cake. There are so many classes online that you can take in which you actually see people and they're like showing you, like, take 3/4 cup of flour and then beat 2 eggs, and you're seeing what people are doing and you're interacting with other people. So we learn to make that strawberry shortcake that we always wanted to learn to make, and we may also make a new friend, right? Because somebody else on the line may have a lot more in common with you, and you say, "Hey, let me get your number. There's another class that I'm going to attend in which you learn to make carrot cake. I'll let you know about that." And so you make a new friend. Adopt a pet. Um, I don't know if you guys heard, but in the beginning of the pandemic, there were a lot of dogs and cats that were being adopted. Um, and I think that that was for a bunch of different reasons, but one of the reasons was because pets can help us to feel less lonely. There's nothing cuter than that fluffy little cat or that fluffy little dog, or maybe you like big dogs, to keep you company, right? So when you adopt a dog or when you get a dog, or especially a dog, you now have to go outside and walk your dog, right? So it gives you opportunity to go outside. You can't have any more excuses as to why you're not going out. If you're making excuses as to why you're not going out, now you have to go out because you have to walk your dog. When you walk your dog, you meet other dog owners and walkers, right? So that gives us an opportunity to socialize and interact with them. Um, and pets are loving, right? Pets are living things that desire and request love and give love. And so when you're feeling sad, when you're feeling lonely, when you're feeling isolated, or when you need to hug someone, you can hug your little pet. So this is why I included that on the list.
While a lot of people did adopt them in the beginning, the
Hmm.
shelters actually did fill up quite quickly once things started opening up again. So
Okay.
I just want to say, if adopting a pet is on your list, it's
Hmm.
for life.
Hmm.
So they are amazing. I love them. I have 5 of them, but
Oh.
it's not for a temporary until things get better. Definitely, it's a living creature.
Absolutely, absolutely. And thank you for saying that, Chris, because yes, people um, adopt pets for all sorts of reasons, and maybe during the height of the pandemic, they were feeling especially lonely and really wanted a cuddly little cat or a cuddly little puppy. But these are living things that require lots of commitment, lots of money too. So if this is something that you feel that you want to have because you're lonely in the moment or you're not connected in the moment, but you don't really think that this is something you'd want to do long term, then maybe adopting a pet is not for you, because it's difficult for pets to get adopted, and then the older they get, the less likely they are to be adopted. Just like kids, unfortunately. So it is a lifelong commitment. So you may or may not want to do that. But if you can commit to it, it's a wonderful way to reduce the loneliness and isolation. And then, as always, I can't end the presentation without encouraging people to practice self care. That means eat well, get enough sleep, and exercise. When we exercise, we get the dopamines going in our brain that help us to feel better, right? We lubricate our joints. So if there's any stiffness in your joints, you're feeling better because of that, because we've gotten something done for ourselves. So exercise is very, very important. Getting enough sleep is very, very important. I know that I'm irritable when I have not had enough sleep. I don't know about anybody else. When we rest, when we sleep, our organs rejuvenate themselves. Our bodies have something to do at night when we're sleeping. So, getting enough sleep is very important. And eating well is important because we want to really fuel our bodies to the best of our ability. So, fresh fruits and vegetables, as much as we can, also contributes to us feeling physically better. Um, and so that is a short list in comparison to all of the things that you can do. But the point I really want to make is that if you're feeling lonely, if you're feeling isolated, if you're not having as much social interactions as that you wish that you really would at this point, definitely make an effort to get out and to participate in something with other people. It's really important to do that, and it's also important to know when to ask for help, right? Because after being lonely for an extended period of time, sometimes some people can be lonely for longer before they start getting depressed, and some people may start getting depressed right away. So it's important to know when you need help. Definitely speak to your doctor or your therapist about your feelings of loneliness. And I've included um, some context informations here, the National Suicide Prevention Line, the crisis text line, the NYC Well, and also to talk to your doctor or your therapist, because loneliness is part of some of the mental health crisis that we're having here in this country. So it's important to address it and address it sufficiently and thoroughly, and have hope that we are going to get to the other side and that we are going to be able to get back to the point where we can socialize as much as we can with our friends and with our family.